Okay, hello everybody. We're very fortunate today to have Caroline Buckee as a speaker. Karen is an associate director of the Center for Communicable Disease Dynamics. We've had a few speakers from that group, which is great to have one more. They're all very informed and doing a lot during this pandemic to help the state and the country do the right thing. So Caroline, with her students and postdocs, they use mathematical models and data analysis to understand the mechanisms driving the spread of infectious diseases. And her focus is on pathogens like malaria that affect vulnerable populations in low-income countries. Some of her recent work, though, this is what we're going to be talking about more today, is using new technologies to track population movement. And I'll also add that I've worked with Caroline before because she was the person who organized the study that we did to estimate deaths after Hurricane Maria. And ever since that collaboration, we've been working on other projects, and she's one of my favorite collaborator. And here she is today to tell us about how we use new technologies to track population movements. Thanks for joining us, Caroline.
Thank you. So I've been working for quite some time actually on the impact of mobility and migration on the spread of infectious diseases and in epidemic forecasting. A lot of what I've been working on is how you use new sources of information about migration to parameterize mathematical models of disease spread. So I've been doing that for about 10 years, working primarily internationally and with mobile phone operators. And so that's kind of the foundation for the work I'm going to present today. And I'm going to mainly talk about the US, but this extends to international work as well. Okay, so the fundamental problem that we have with the COVID-19 pandemic, or one of the fundamental problems, is that we don't have very good indicators, epidemiological indicators of transmission itself. We have lagged and imperfect indicators. So let's just imagine this is a person who becomes infected. There's an incubation period. We think that's about 5 days before they get symptoms, if they get symptoms at all. At that point, they may get tested. There may be some delay in turnaround time for testing until they are classified as COVID positive. They may or may not infect people during that time. And then they're isolated perhaps at some point, then hospitalized, and then several weeks later, maybe 3 weeks to a month later, if that person is going to die, they don't die until much later. So if we look at the epidemiological dynamics that we can analyze to understand what's going on with the epidemic, we have confirmed cases, and I'm sure you're all aware with the kind of systemic problems with testing capacity, delays in testing, and all of these kinds of things. So that's an imperfect indicator and lagged because the testing doesn't happen until sometime after the infection itself. Of those confirmed cases, some fraction end up in hospital, those who are severely affected. And then of those, some smaller fraction die. So we have these epidemic curves that represent different aspects of the epidemiology of the virus, but none of them accurately represent transmission, the process of transmission itself. And so what that means is that we have to either rely on proxies for transmission or back calculate what's happening when the virus is actually spreading between people. So this has been one of the biggest problems that we've had, both in understanding where we are, but also in forecasting and making sense of whether interventions are working or not. But really, this is just a list of all of the lockdowns that have happened. What we've seen with this pandemic is really an unprecedented behavioral change in response to an outbreak, with lockdowns and almost complete cessation of normal human behavior happening on a global scale. So this is really a very unusual event. And of course, the epidemic itself is unusually devastating for lots of reasons. But this change in human behavior is absolutely profound. And it's something that relates to this issue of mobility and migration, because one of the things that we may want to keep track of is not just what interventions are going in place, and what's happening with cases, but also what is the population behavioral response to the interventions that are put in place, and how does that change with respect to cases spreading through the environment.
Can I ask about that plot? First, it's ordered alphabetically, huh?
Hmm?
It's ordered
Yes.
alphabetically. Okay.
Yes, I just pulled it from the internet.
Okay, and what's the red and the blue and the red and green?
It's just when the lockdown started, and then it shows the timing of when some retail was opened up and stuff like that. It's really only meant to show that this has been like the entire world shutting down.
Got it.
Which is really, you know, not something that ever happens.
Yeah.
And so one of the ways that we can think about the impact of behavior and these lockdowns on transmission is to kind of separate it into two components. And we do this in our models as well. We think about the transmission that happens within populations. And here you see, this is from very recent photo in Wisconsin, people, you know, interacting, close contact. This is a directly born, a directly transmitted virus. And then there's interactions between populations where you have spatial spread due to travel and mobility between them. So you have importation risks, and then you have the risk of spreading the virus elsewhere. And so for an infectious disease epidemiologist, we often model these as different things. So we may have, you know, populations where we're modeling transmission within the population, and then we're trying to understand how it's going to spread to other populations. And so as part of that effort to understand what's happening with lockdowns and with travel restrictions and the likely spread of the virus, we've seen just an amazing deluge of data that has emerged in a really unprecedented way. And this is all data from mobile phones. And although this field has been developing for over a decade now, this really represents a sea change in the type of data, in the volume of data, and in the acceptability of using personal data from mobile phones in an aggregated way to understand the movement patterns of populations. So you may have seen these. Apple has its mobility report, Google has its mobility report, Cubic, and so on. And I'm going to walk through what these data are, where they come from, when I talk about how we might use it. I think one of the challenges that we've seen is that there's this enormous deluge of data, and for decision makers, it's not at all clear what the data mean. They're receiving it in a way that is difficult to interpret, and sometimes it's hard to make actionable decisions based on what they're seeing on these many dashboards. Mm-hmm. So I'm going to distinguish between two kinds of data. The first is data from mobile operators. So this is fairly well regulated data that is collected by mobile operators whenever you use your phone, and they're called call detail records, or CDRs. And essentially what you have is a series of events that are, you know, when you use your phone to make a call or text, and those are associated with a cell tower ID. That's the cell tower that routes the activity on your phone. And so as you move through your day, and these are just meant to represent the kind of Voronoi diagram of separating out some space, with the cell towers are meant to be these little blue dots. And as you move around and you're making calls, you're getting a stream of data about where you are over time. And there are some nuances with this data, because sometimes multiple towers pick up the call, and the density of the cell towers really is going to determine the resolution of your data. So in cities, it's pretty good. In rural areas, it's not so good. And then you have, you know, people are making calls in sporadic ways to do with when they're awake and asleep. And what's happening is that you can interpolate between these data points and build up a pattern of what's happening. Now, the kinds of data that's usually shared for this kind of application is aggregated at, say, the cell tower level. So you're not following individuals through time, you're following people who are active at this cell tower on a particular day. So you're aggregating in space and time, and then you're monitoring movements of groups of people. And this kind of data is highly regulated. There's usually a national regulator that is separate from the government, and they determine what you can use this data for. In contrast, many of the dashboards that you might have seen, things like SafeGraph and so on, they are using Adtech data. So this is data that is collected on your phone because of ads that are being targeted to you. And this is a much more difficult data set to understand. And so
sorry, let me see if I understand, make sure before you keep going. So the first data set is basically these companies know where you are at all times in principle, right?
Well,
because
yes.
they get the whatever the signal from the towers. But for this one, you have to either get on an app or do something.
Yes.
So okay, so the first one, if you really want full information, the first one has more than this, yeah.
And the other thing is that the first one, for low income settings and places where people don't have smartphones, the first one is often the only kind of information you have, because it's not a smartphone kind of thing. And I should say that first kind of data is much more regulated, so it's much more restricted in what you can do and so on.
And then another question, I think you said this, but you have to make a phone call or send a text?
So it depends. It slightly depends on the operator, but in many cases you have to have an activity. So what they are actually measuring, they'll have a date and time stamp.
Got it.
You know, the caller 1, caller 2, and the cell tower ID. And so it's time-stamped discrete data rather than a kind of continuous.
That's the little plot you had at the bottom. Got it. Okay.
Right. So this data from Adtech data is different, and it undergoes a whole bunch of processing, much of which is opaque, and you don't actually know what you're getting. So usually the only indicator of representativeness with this data is that they'll give you the monthly active users. So that's, you know, somebody that used an app once, maybe they signed up for something once and didn't like it. Maybe they just show up for a few days or sporadically, you don't know. So it's not like a longitudinal data set in the traditional sense. And because the people that are publishing the data and the people that are providing the data to researchers are different, it's very hard to figure out some of the missingness issues as well as the representativeness issues. So I'm going to talk about that more in the future, but I just want to make sure that there are different kinds of data that we're talking about for this kind of approach. Okay. So at the beginning of the outbreak, when it became apparent that non-pharmaceutical interventions are going to be the best way we have to control things, and that means lockdowns and so on, together with Sachit Balsari and Andrew Schroeder, who's at Direct Relief. Sachit Balsari is a faculty here at HMS. We developed this network of researchers with a specific operational goal to take some of these data streams and put them into situation reports that we interpret and share with policymakers, and we update them every day. So really a very operational goal of making partnerships where we can figure out what policymakers need to make decisions and help them in that. And this is a research network that's grown to many countries, many more than are highlighted on this map. And the idea is that as a group, we can come up with standardized approaches to aggregation and methods, which are still in their infancy and certainly changing very fast. So the data that I'm going to present here is a result of this collaboration. And our main source of data right now is with Facebook. So it's Facebook data, and their process is not like Adtech. It's, you know, if you have your location services turned on the mobile app, then you're in the data set, and then they aggregate and share with researchers under a DUA. So we have a number of different types of data, and one of the things we're doing is trying to understand the differences in data quality and what they really can be used for. Much of the stuff that I'm going to present today is the result of work from Nishant Kishore, who is my graduate student. So I just want to acknowledge him up front. And this is the kind of output that Facebook produces. And then what we do is we tailor the reports much more specifically on a smaller level. So here's what's happened in Florida, for example, by county. You can see from the beginning of March all the way up till the end of July. And there was you know, mobility in general was reduced. And then it's slowly come back. Now, I haven't yet talked about how mobility is measured. There are many different ways that you can measure this, right? There's movements in and out of the county. There's movements within a county. There's shelter in place. So how long do you spend in the place that we have designated your home location? And all of this is measured relative to baseline. And in this case—
Caroline, this is 0 is you have a baseline, and then
Baseline.
this is the percent decrease in in how much they're moving, or the number of
Yes.
people that are moving.
It's in the average movement per user. So this is how much people are moving around. And there's about 20 different metrics that you can use. And many of the dashboards that you'll see, they're all using a slightly different thing. So Facebook has a multiple metrics. One of them is like stay at home, what fraction of people are staying home. Some of them are to do with movement out of a county. Some of them are to do with a radius of gyration measure, which combines the frequency of trips and their distance. So there are a number of different metrics that can be used. And I'll talk at the end about kind of how correlated they are and how to think about them.
And those peaks, are those weekends, and then they go down?
Yeah, so there's often a weekend, for all of these kinds of data, there's often a very distinctive weekend pattern in mobility.
It went from going down and then it starts going up.
Yes, so since April, it's been gradually returning to baseline, and that's true everywhere. So in Florida, we've seen a gradual return. It's not at baseline yet, but it's getting there. And in some parts of the panhandle, we're actually seeing movement patterns that are quite high. Similarly, in Texas, you can see it's heterogeneous, but in some counties, we're seeing quite significant increases in mobility.
And I'm sorry, I can't
this
read.
Is relative to baseline.
I can't read it says what those bars say, like the
These
red,
ones?
blue, yeah, what do those say?
That's state of emergency declared. School closures is in blue, and the green is shelter in place. These don't end. These should end, I think, actually, because these were finished before now. So, but that's when they started.
I see.
So you can go onto the website and play with these and look at different states and counties and have a look.
Cool.
So here's an example of a more detailed report that we can produce. So this is one that we would produce for Massachusetts, where here we're looking at the Facebook population aggregated today. So really this is looking at changes in density of people in different neighborhoods. And this is helpful for policymakers, for example, because you can see that places that have really gone down are often commercial districts and places where people work. The waterfront, Fenway, and so on, downtown, Chinatown.
And I'm sorry, you're measuring the people that live there, or the?
It's just looking at the percent difference from baseline of the how many devices were in that place.
Devices.
So it's density. If you can think about it as where people are.
Got it.
So
got it.
These places, it's gone down. It's remained down. This was through most of June, I think. And then in places that have stayed the same, they're residential areas where obviously people are there more. So in residential areas, people have kind of remained. So some of these indicators are useful, and they're not necessarily proxies for transmission per se, but they're giving you an indicator of what's happening behaviorally with people being in different neighborhoods and moving around. And again, you can see this weekday dynamic.
So we have a question from the audience, and I think you answered it, but let me make sure. The baseline is what, a few weeks before or a whole year before? What's the baseline?
So the baseline issue is really important because Facebook, and the baseline issue is an issue for all of these data sets. It happens that for Facebook, their baseline is 45 days prior to the first data request or something like this. So assuming your baseline covers before COVID, that's fine. Maybe it's fine, although there's some seasonality things that might come up, right? But if the data didn't start being produced until May, then your baseline might not be relevant for what you want to know. So the whole issue of when these dashboards are showing relative change, that baseline issue is really important. And as much as possible, we would prefer to get that the same month last year. And some data providers can provide that, but for example, mobile phone operators tend to have a attrition, so they'll keep the data for a certain amount of time and then they'll get rid of it. So the baseline issue is something that is very important and variable. So you can see particular kinds of behavior that are relevant for outbreaks. This shows, for example, the relative increase in population density in counties around the country on Memorial Day. And it provides you with some sense of where you might expect outbreaks in, in a week, 2 weeks, 3 weeks time. So some of this data is useful just in terms of seeing anomalous behavior that is predictive of what might be coming down the pipeline in terms of cases and test positivity rates and so on.
And that I am seeing that some of those, some of those just might be super small counties that have more variability. Yeah,
absolutely. So all of this data is quite nuanced, and there's definitely an urban-rural difference in uncertainty, and I'm going to talk about that at the end.
So before you get going, there's a question from the audience about how do you get the data from Facebook? They just send
we
it
have
to
a DUA.
Yeah.
We have a DUA with Facebook, and then they have a portal. It's called
That's a data use agreement for those that don't.
Yeah, we have a data use agreement. And then, so all of the researchers in the network, we have facilitated each of them to have a DUA with Facebook, and it's an institutional DUA. Mm-hmm. And so then you access the data through they have a web portal. And that's the same with Canva systems. We work with this company called Canva that has lots of different Adtech data providers that they put together. Similarly, we work with them under a DUA. Facebook has an explicit policy that they don't share data with government agencies. And so each company has a slightly different sort of framework. Okay, so there are some general things that have happened that we've seen in this data over the course of this epidemic. One is that urban centers have emptied out. So, and many of you have probably experienced this. So a lot of people that were in cities left cities. And this has happened internationally. It's happened in India, in Spain, in France, everywhere we've looked, Chile. Everywhere we've looked, we've seen people leave cities, sometimes as a result of a lockdown order or a shelter-in-place order. So the order will be given that, there's going to be a lockdown, and then a bunch of people leave for the countryside. And we've seen it in the US as well. So this graph shows, this is I think this line is when the state of emergency was declared, more or less. And here again, 0 is the baseline. And then we're looking at the nighttime weekday Facebook population. This just brings up another issue, which is, we think the nighttime population represents who lives there. So that's why we're using that. And if you look at the rate of the decrease in the population in urban places, so here, I don't know if you can all see, but so Atlanta and Boston, we've seen a massive decline in the overall population density in these cities.
And Boston is these are, what's Boston? It's the actual city or the metro area?
I can't remember what this is exactly. I think this is the metro area.
Okay, wow.
So this has important implications as well for what's going to happen when schools and colleges, when people start coming back, what's going to happen, especially if these, depending on where people have gone.
So wait, what you're saying is that what are you implying? That now the situation that at least in Massachusetts is pretty okay. Mm-hmm. That it's okay because there's so few people in the dense areas, but it could get much worse when people come back. I think that it depends who these people are. And for white collar workers that don't have children who are able to stay in the countryside, maybe they will. I think for a lot of people with schools opening, they may need to be coming back to the city, and that will change things. So just from a population density standpoint, it will increase possibilities for transmission potentially. So here's an example from New York, and you can see that the residential areas around have not appreciably changed in their density, but Manhattan was really emptied out very dramatically. And what's that other thing? There's some other place way out on,
I don't know where that is. Who knows where that is?
Looks like where JFK is or something. I don't know.
Yeah, I'm not sure what that one is in particular. I know that there's an airport here, maybe.
That's LaGuardia, yeah.
Yeah. So this is heterogeneous within cities, to your point, Rafa. So we can sort of crudely measure what's happening, but actually it's really focused in particular parts of cities. And Manhattan is a case in point. And so this is the travel out of Manhattan. Oh, it's a bit frenetic, I'm afraid. But you can see that Nishant made this, and it just shows you where people went in that pre-epidemic period.
I see.
Before
They're
the
going
travel.
they're going upstate is where they're going.
They're going, yeah, they're going upstate, and some also to other places. But again, the implication for initial spread of the epidemic, and then what that means if people come back, is something that we can keep track of in this way. So it's not just looking at movement within and where people are, but also where are they going and where do we think importation is going to happen. So interestingly, you can use this data to start looking at transmission, because the movement patterns are interesting, but what we really want is to understand what it means for the epidemic. So we're in work with Jonathan Grad in IID and Stephen Kistler, his PhD student, or postdoc, sorry. They were in part of a seroprevalence survey among pregnant women in New York. So pregnant women is a fairly good random sample. Because they're just a selection of people from around. And what you can see is the seroprevalence varied a lot, and we had the lowest prevalence in Manhattan. But if you look at
25%, that's 25% of
delivering women
had
yeah. So there was a direct relationship between the seroprevalence measured in these neighborhoods and the % decline in commuting patterns. So commuting patterns here was a specific kind of movement we can measure with this data of movement one way in the morning and another way in the afternoon. So out of the neighborhood in the morning and into the neighborhood in the afternoon. And we found that that's actually been a very good proxy for many of the epidemiological characteristics. And so, of course, the reality is that the people that kept commuting are the ones that couldn't afford not to or were essential workers. And so coupled with this emptying out of Manhattan, and then essential workers and low-income neighborhoods had to continue to work, we think that that's really relevant for what's happened with how the epidemic has gone and why some of these communities were hit so hard. But one thing that we're trying to do is to understand how these different metrics might relate to the different structure and demographics of different populations. So, this is a comparison of counties in New York versus Arkansas, for example. What does it mean to have 20% mobility change in an Arkansas county compared to a New York county? Urban settings where people are, walking and live in a different way might have very different contact patterns related to their mobility changes compared to rural counties where people are in their cars and they're going long distances, but that's not going to affect their transmission potential. So we've been trying to understand this in a more geographically contextual way.
And can I ask you something about what this movement means exactly? So if this isn't going to catch, or maybe it will, if people are having house parties or whatever is going on in Cape Cod right now, like that's not caught here, right? Because it's too close, or it is? So
what would be caught here, you would capture if people are traveling. So it would capture fractions staying at home, right? And it would capture the travel that people had to do to get to that house party. What it wouldn't capture, it does, it would be like, were they outside 6 feet apart wearing a mask or not?
Sure, I get that. So it does catch, so those small distances are also in there somewhere.
It is, but remember it's Facebook users with location turned on, it's.
Sure, no, I know, but okay.
Yeah.
No, I'm just thinking that there's two kinds of movements here. There's like you showed in your earlier slide, there's the movement that of you going to some location where you can you're exposed, and then there's the movement of you taking it somewhere else. The first one's short, the second one's long.
That's right.
Longer.
So I think the longer range movements are much easier to catch, obviously.
Yes.
But the short range movements are also, you can measure them to some extent as well.
But up to now, the analyses aren't trying to distinguish between these two.
Well, they are in the sense that it depends which metric you're using and what you're comparing it to. Okay. So out of county movements, you would be trying to look at like what fraction of people went to which counties and what that means for the risk of importation to them. If you're trying to look at within county movement, then you'd be looking at different metrics and comparing it to the epidemiology in a different way.
Okay.
Okay, so just before we start the discussion, so this is a collaboration with Nick Menzies, who's in GHP, and Ted Cohen, who's at Yale, and my postdoc Amy Taylor, and Pierre Jacob, who's in the stats department, and Nishant again. So because of this issue with the time lags and the delays, you can't really get a really robust epidemiological indicator from confirmed cases almost anywhere. So Sarah McGough in Nick's group, they had published a sort of a nowcasting approach recently. And so the idea behind what we've done with them is that you look at deaths, which are probably the most robust indicators of the epidemic, although they are still probably underestimated as well, but still. So you use deaths, and then you use a model framework to back calculate the number of infections and the timeline of when transmission was happening in that community. So Nick's done that for all of the counties in the US for which there is sufficient cases and deaths that the method. And
what's this
works.
one? Did you say which one this is?
Which county? Oh, I don't know.
Whatever. It's okay.
It's an example of one. I don't know which one it is.
Yeah.
And they don't fit. It doesn't, like, it's difficult, right? Because the deaths themselves are a fraction of hospitalizations, which are a fraction of symptomatic cases, which are a fraction of actual infections. And so at each stage you're making assumptions. So it's not perfect, but it works okay. So from that you can calculate a reproduction number, an effective reproduction number, RT. And this is just an example. Oh, this is from somewhere in Alabama. So you can come up with some RT estimate, and the reproduction number is of course kind of a useful metric for looking at transmission dynamics. So what we've been doing is comparing that on a county basis with some of these metrics of movement. So this one just shows, this is from Facebook data, but we've been using lots of different kinds of data. This is movement in and out. So this is kind of cross-county movement. And then this is the movement within one of those measures. There are many different metrics you could use. And we're trying to understand what is the relationship between changes in the reproduction number and changes in mobility. And so you see that actually I think this is a log change in RT and the log change in mobility. So you can see that they're related, right? But what's interesting is that the model fit declines very dramatically as you go from urban to rural. So this is the fit of the model, and it's not simply these two metrics.
Yeah, that one on the left probably has some ecological effect in it.
Yeah, and I think as well, autocorrelate. I think that there's a lot of stuff going on, right? Because everything is sort of correlated. But you can fit a model where you're looking at which mobility predictors are best indicators for changes in the reproduction number. And what we did was we run those models, and then we looked in counties categorized by their urbanness. And this is a standard. Each county has on a scale from 1 to 6, they're classified as a rural or urban on this gradient from central metro all the way down to non-core. So we stratified by that, and what you can see is that the fits drop off really significantly as expected. But essentially this speaks to what you were saying, Rafa, which is that, so it's hard to point to whether this is a data problem on the epi side, a data problem on the mobility side, some combination of both, or something else. But really what's happening is that these metrics in rural counties, there's a lot of missingness. It's not clear whether representativeness falls off. And we have a lot more uncertainty, probably with the epi data as well. So that's just to say, I think that there's a lot of work to be done in trying to understand how robust the mobility data are, and probably the epi data as well, but we're focused on the mobility data. And the urban-rural gradient is a big one. So just to finish, in collaboration with Navin Vemba, Camber, and Matt Kiang, who's a former PhD student with Nishant, we've been pulling together all these data sources from Google and Cubic and Camber and Apple and everything, and trying to understand how they relate to each other and where we have missingness problems and where they're correlated and where the metrics aren't correlated and so on. And to try to start to quantify what the biases are in this data. And I would say that this is one of the biggest problems for this field. With COVID-19, we've seen an absolute kind of waterfall of data emerging as acceptable to share and with very little thought to whether the metrics are sensible and how you would actually use them and what they mean for policymakers. So I'm not going to kind of go into this, just to say that this is something that we're trying to do in a really systematic way with the network and with all these different data sets, because at the moment it's very much a nascent field. And I think the big issues, this is about to come out in Lancet Digital Health, this paper. The big issues, obviously representativeness is a big issue. This data is almost never broken down by demographics, and that's for good reasons, but it makes it difficult to understand exactly who you're getting. The baselines that have been brought up before, that's something that we need to kind of understand before using this data. And then the privacy aspect is something that I've seen kind of unraveling during this outbreak with increasing lenience on sharing data at quite high resolution by a number of data providers. And that seems very, very problematic to me. And I think a number of them have an eye to monetizing this data without necessarily having policymakers understand its limitations or how to use it on the other end. So that's something I'm happy to discuss. And then I should just, I should acknowledge, so a lot of the work was done by Nick and in collaboration with Ted, and Nishant did a lot of it too in my lab here. So yes, happy to.
Thank you.
Shall I stop sharing?
We have some questions from the audience. That was great. So first one, do you recommend Facebook data over SafeGraph data? How do you access the first-tier cell phone data mentioned earlier, the non-Adtech data?
So the big players in terms of representativeness and coverage are people like Google and Facebook and Apple. SafeGraph, I think SafeGraph has limitations, not just in terms of how they're thinking about privacy and data resolution, but also representativeness and transparency around representativeness. So that's true for a lot of the Adtech data providers. And I think that Facebook is good because they have a very structured way. They have a team that's been working on this for a long time, and they work in a very structured way. The DUA is institutional, so if you are at Harvard, you would be covered by the DUA with Facebook. So, but in general, I don't think Facebook is the be all and end all. It's just that compared to the Adtech data, I think it is more reliable because it just has better reach, and it's like easier to understand and more transparent. But I think in many international settings, and especially in low and middle income countries, CDRs, Facebook isn't very good because you don't have the penetration outside of cities. In some places you do, like Botswana and Colombia and Chile, but in places like India or Bangladesh, really Facebook is okay for cities maybe, but then outside you need CDR. And that's, so yeah.
Oh, the next question, is there a difference in the population of Facebook location live turned on people between geographies?
Say that again?
Yeah, let me read it again. Is there a difference in population of, in quotes, Facebook location live turned on people between geographies?
I think that's a question about representativeness.
Yeah, I think so, right?
So
the proportion of people in different areas.
Yes, I'm sure there is. So I think that there are certainly international differences in like cultural acceptance of turning on your location data.
Right.
But even within the States, that's probably true.
Yeah.
You can work to get denominators in some sense of demographics, but it's usually very highly aggregated at that level.
So next question is from Anson Parker. How granular is the data you have access to in terms of latitude, longitude? Is it block level, house level?
No, so it depends.
Timestamps. Yeah, there's timestamps.
Yeah, so the data, so quite a few providers give it at the census block, census tract, or neighborhood within the research setting. A lot of them just put out county level metrics. And then things like SafeGraph, they give out, specific locations and foot traffic data. So the data providers have much more granular. They can like tell where you live and stuff, but the stuff that they provide is usually on the census tract or bigger.
Cool. So Hector Perez asks a question that I was going to ask you. First, he says, great presentation, congratulations. Data analysis sometimes gives us new insights about new data we need to obtain. What information and data needs for continuing this sort of analysis and to improve future insights or models? Like what have you learned from this analysis that you need, that you would like to have now? I wish I had X or Y.
I think seroprevalence is a big one. Because at the moment, you can't rely on confirmed cases. So I guess for me, it's really the sort of basic epidemiological indicators. Of course, for this type of analysis, what I would love to have, I would love to know more detail about who is represented in the data sets. So even just age structure, right? Like it would make a big difference if we could adjust our county estimates by knowing the age distribution of the users in the data. So even something as simple as that would be really helpful. I think that starts to violate some privacy issues, and I understand why we don't have that. But there could be ways to share it in ways.
Stratifying maybe.
Yeah.
Yeah. All right. A question from Dan Hapty. Oh, another one I was going to ask you related to something I was going to ask you. Do you have any insights into what sorts of movement patterns are more dangerous and what are less dangerous? So a similar question is, are the lockdowns actually helping, or is it maybe just the way people are behaving just from the information they get? Like I'm starting to wonder now if instead of lockdowns, we should just educate people what to do. This person asked, is there something we learn here about what's dangerous and what isn't in terms of movement? And I'm asking, like, what do you think about the actual lockdowns? Do they have an effect?
The one thing about lockdowns, especially travel restrictions, is that people do a lot to get out of them. And you can end up, what we've seen in the data is that you can end up with a travel surge right before a lockdown.
Yeah,
and that's
happened,
obviously, it's happened all over the place. And that's obviously counterproductive. We've seen that in this country and all over the world. So I think we can learn that those types of travel restrictions, if not done very carefully, can actually lead to the spreading of outbreaks. And I mean, I certainly think that the long range travel is problematic, especially like if you think about this country right now, we're going to see an influx of college students from Florida, Texas, California, and so on. And that's undoubtedly going to be a problem for importation. As far as the movements, the more local movements, I think what we've really seen, what we've been measuring is actually, people going to work is what's predictive of seroprevalence. So what that means is what we kind of knew already, which is poor communities that have to keep working, that's a problem. And then we have these mass gatherings like on Memorial Day and so on that can spark outbreaks, but they're more sort of stochastic.
But do you see that? Okay, so in your data, is that something you would learn? I suppose you didn't know that happened. Would you have seen it?
We would have picked up the anomalous movement patterns. It's quite hard to link that definitively to outbreaks, given everything. But I think you can start to see, like for example, in Spain, there was a lockdown and we saw people moving out of Madrid, and then there was a shift in the age group of cases
Yeah.
some of these rural areas, right? You can kind of back calculate what must have happened, even if you can't directly link the data. So I think as far as movement patterns, you know, if there's a kind of disconnect, I guess. The movement patterns we can actually measure that are dangerous are these long distance migrations and commuting patterns. When we think about like Massachusetts right now with the cases creeping up, that's clearly about opening bars and gyms and restaurants and people kind of loosening up in general. And the movement patterns have got closer to baseline, but they're still quite far below. So I think there might be a divergence between the epidemiology and the movement patterns as we move forward in the epidemic. So they were very tightly linked at the beginning, and it might become less so as we move on. Yeah,
good. Great. Well, thanks so much for taking the time to talk to us. That was very educational, very enlightening, and entertaining. Bye-bye, everybody. Thanks for joining.
Bye.